Watch this.
Oregon has very proudly provided abortion care to women from out of
From out of state, as he said. In less than a month, women in Idaho are going to have to look outside of the state to seek an abortion after 6 weeks of pregnancy. That's because last week, Governor Little signed Senate Bill 1309 into law. In the meantime, providers in neighboring states like Oregon are bracing for impact and discussing how they will adapt to treating an influx of patients likely from Idaho. Here's Katya Stepovic.
We are already seeing patients flying in from Texas. I anticipate, and we in our department anticipate, that will increase.
Mark Nichols is a doctor of medicine and professor at the Department of OBGYN at Oregon Health and Science University in Portland.
We're already seeing people drive in from Idaho to our facilities here at OHSU and to the Bend Clinic in Planned Parenthood.
He says right now Oregon provides about 6,000 abortions per year, and about 10% of those are from out-of-state patients. And he anticipates that the number of out-of-state patients will rise once Senate Bill 1309, banning most abortions in Idaho after 6 weeks, goes into effect.
The closest clinic for folks in Idaho is a Planned Parenthood clinic in Bend, Oregon. That's about 250 miles from Boise. So women will be facing a 500-mile round trip adventure to come and get abortion care. Women from Idaho will continue to seek abortions when they are facing an unplanned, undesired pregnancy. And consequently, I'm sure they're going to be looking to us for care.
While still in its early phases, OHSU and Planned Parenthood have plans to meet the increased demands.
I do know that plans are being developed to provide services closer to the border, either directly in person or even across state lines via telemedicine. Mobile vans could be on the road tomorrow. There are medical office buildings closer to the border that could be rented.
He says about 70% of abortions in Oregon are done by medications that are FDA approved. The procedure can be provided solely by telemedicine. Right now, he has patients both in California and Washington using the out-of-state service. Idaho could be next.
There is an evaluation that has to happen for patients to confirm that they're of a gestational age where this service can be provided. That involves generally an ultrasound, but that can be obtained in Idaho. The medications then can be provided by mail to the patients. They're given very detailed and clear instructions as to what is likely to happen, what the complications might be, and then they take the medications at home and they expel the pregnancy.
But 10 to 15% of patients are beyond that point in their pregnancy, where in-person visits are required, even for out-of-state patients.
Those individuals will need more complicated care. And right now, that is going to require a trip to Bend.
Whether it's more clinics near Idaho's border or expanding telemedicine services, he says OHSU and Planned Parenthood will meet the demand for women in Idaho seeking abortions after 6 weeks.
Abortion is healthcare. Just expanding healthcare is something that ought to happen.
Also commented on the matter from their Bend location. They said in part, quote, they are expecting a dramatic increase in patient volumes. They say we want to have the ability to therefore care for our out-of-state neighbors while continuing to meet the needs of our patients in Central Oregon. They say we are training staff to be really better prepared so we can build our capacity for this very moment.
All right, Katya, I'm getting a little closer to you because your microphone seems to have a little trouble, but I wanted to ask you this. So Dr. Nichols mentioned medications that can be mailed to a patient. We were talking about this, whether or not that can actually happen to somebody in Idaho. Could somebody in Idaho ask for this medication to be mailed to them?
Yeah, and it is a little bit of a gray area, right? Because the patient would be taking it in state, but the provider would be technically out of state, like you said. And according to Planned Parenthood's legal team, I want to read this. They said a provider cannot mail medication, abortion medicine into the state because they would be practicing without a license, which is required in Idaho. And further, if they're licensed in Idaho, they are subject to Idaho laws and statutes, which in this case they cannot do.
Okay, so that clears up. Just came in just a few moments ago, that text message, by the way, to help clear that up. Because that was a question we were wondering, like, is there a way that maybe somebody can circumvent this law by using this medication? As you said, Dr. Nichols said a lot of his patients are choosing that method as opposed to a procedure.
But that said, they can still go to Oregon and take the pill that way.
Okay, thank you very much, Katya. All right, well, this